Dr. Whitmont is currently president of the American Institute of Homeopathy, America's oldest extant national medical association, past president of the Homeopathic Medical Society of the state of New York, and clinical assistant professor of family and community medicine at New York's Medical College. Dr. Whitmont is a second-generation classical homeopathic physician who maintains offices in Rhinebeck and New York City. Welcome, Dr. Whitmont.
Thanks, everyone, for coming. It's so encouraging to see so many people attending one of these events in integrative medicine. So encouraging to see so many vendors that are offering support in this field. I'm honored to be welcomed here and to be invited to speak. Today I'm going to be talking about something, a different paradigm of medicine. And instead of fixing and repairing the problems with the microbiome, and instead of dealing with environmental toxins and stress, I'm going to be talking about a mode of therapy that actually prevents these things. And that's why the paradigm is a shift. And I also want to briefly go over in a nutshell what I'm going to be talking about today. We're going to start talking about the microbiome and segue into the epidemic of chronic inflammatory illness that's affecting our society and our world today. And from there, we're going to move on to chronic Lyme disease, which is essentially a chronic inflammatory condition. And at that stage, we're going to then break off and talk about homeopathic medicine and give you some of the background and some of the evidence for homeopathy. And I will present you a case of Lyme disease in a 92-year-old male who was treated with homeopathy and got very good results with the results. I'm going to be talking about classical homeopathic medicine predominantly. There are different types of homeopathy in terms of clinical homeopathy and classical, and we can entertain questions about that if there's interest. I also will address that to some degree later on. So as I said, we're going to be covering the human microbiome, chronic inflammatory disease, and then Lyme disease as a chronic inflammatory disease, and homeopathy. So a reminder here that when we're talking about the microbiome, we're talking about a structure with a diversity of a rainforest. That this structure is so vast, this is so large, this is like nothing else we've ever encountered in medicine before. And I guess I would say homeopaths are we whine a lot, and we're like environmentalists, and we whine about environmental change, we whine about climate change, but homeopaths whine about the same process that's going on with the microbiome and the body. And that's really what this is about, that everything you're seeing on a macrocosmic scale with the environment is happening with the body and the microbiome today. And we're going to talk about why that is. So the human microbiome, I'm going to not be telling you what it is. I hope you all know what it is already, but I'm going to be telling you why it's important. We know that the microbiome is an essential ecology that complements the human genome. We know that it is fundamental to our health and to our well-being. And we know that when you have disruption of the microbiome or dysbiosis, it is a key, and it starts an inflammatory process, always, whether you're talking about acute inflammation or chronic inflammation. So we talk about ecological complexity. The body is made up of different ecological niches. I know we tend to talk about the microbiome as if it exists within the gut. Yes, that's probably the largest concentration of microorganisms in the gastrointestinal tract. But the microbiome is throughout the body. It's everywhere on the body, and there are places now that we're finding inside the interior of the body that are related to the microbiome and where the microbiome exists. We'll talk about that. So when they first started looking at, when the scientists at NIH began to look at the microbiome, they started just to catalog it by a few places. But as I said, it is everywhere on the body. And not only that, but everywhere you look on the body, the microbiome is different. It differs slightly between individuals in the same species, but it also differs even when you move millimeters away from the original sampling place. From the microbiome, we have this concept of a supraorganism has emerged. And what a supraorganism means is we essentially are a symbiosis between human and non-human genes. And these things have evolved with us. These microorganisms and their genetic material have come along with us throughout our evolution, and they're actually key to our evolution. If you look at some of the microscopic organelles within our cell, like mitochondria, we have overwhelming evidence that these structures are actually bacteriologically based. In other words, they came from an early infection of cells that were then integrated into the biology of the cell. So this idea that the microbiome is not only around us, it's inside of us. And whenever we use medicines that affect the microbiome, we also run the risk of affecting the structures that we have incorporated within our cellular biology, like mitochondria. And as you know, there have been a lot of presentations and a lot of information about mitochondrial dysfunction. Well, that's a good reason for that. So there's a collective interdependency between the microbiome and the human organism, and it is this continuous spectrum of ecology, diversity, and symbiosis. The microbiome is fully complementary to our health, and we cannot function adequately, properly, or in a healthy manner without the microbiome, and the microbiome doesn't exist without us. That's why we really can't replace the microbiome with anything other than a fecal transplantation. You cannot take any probiotic preparation on the market today that will actually replace your microbiome, because we can't grow these organisms in a laboratory. They only grow alongside us in our bodies. There's supposed to be about at least 10,000 different species of microorganisms living in and on our bodies. This is just a sample from 1 gram of human stool. Just 1 gram. I mean, this is just immense when you start talking about this. And that's why it's important to remember that it's like a rainforest. It's not a simple thing. It's not a lap dog that you can mistreat. It bites you every once in a while and then you feed it a bone. You have to treat the microbiome with respect, and it's something that will affect our health for the rest of our lives when we mistreat it. We know that it's integral to all of these functions, everything from nutrition and development and immunity all the way to mental and physical health throughout our lives. And it is a very important regulator of the human immune system. And that's the point of this lecture. So colonization, we used to believe that colonization of the microbiome started at birth. Made sense. You have a sterile womb and you have a fetus that is growing away from all organisms. It's just not true. It begins in the placenta, and it may even begin earlier than that. But we do have strong data that the microbiome, there is a placental microbiome, and the bacteria in the microbiome of the placenta does not resemble the vaginal flora at all. It most closely resembles the oral flora, what you find in the mouth. So it didn't get there, we don't think. There might be a way it got there, but it probably didn't get there from direct extension. It got there through blood, through other means. The most critical period so far that we understand the microbiome is before birth until the first 2 years of life. And that's not a direct line. I'm sure it's not a sharp line. I'm sure that the critical period extends well beyond that. And we know that the diversity of the microbiome depends upon a lot of things. Some of the primary determinants of this include the maternal microbiome, what the mother has been exposed to, what antibiotics, what drugs she has taken, the whole birth process, even the medication history. Very brief review. In the normal delivery process, you see the newborn coming down the birth canal. The mouth and the face are face down in the normal delivery, and this process exposes the oral mucosa, the lips, the face, to the vaginal mucosa, all the lactobacilli, and also to the introitus, where you will find bacteria, viruses, fungi from the rectum. This is an important inoculation, and this is how one generation to the next passes on the normal microbiome. When you have a delivery process that involves C-section, you've interrupted this procession, and many obstetrician gynecologists today are beginning to swab the newborn with vaginal swabs, rectal swabs, which makes very good sense. So, how do we damage the microbiome? There's lots of ways we can do it. We know that antibiotics, antifungals, and antivirals will damage it. We know the proton pump inhibitors. And there's strong evidence that these other medications damage it as well, particularly immunosuppressants. Vaccines may not directly damage the microbiome, but they prevent exposure. If you have eliminated a disease, and you'll see in a little bit why this is important, when you eliminate a disease from the natural microbiome, you've actually eliminated a stimulant to the immune system. So antibiotics, very simply, they disrupt the microbiome by allowing the overgrowth of resistant organisms and damage and sometimes eradication of sensitive organisms. They also promote viral overgrowth. And we know that maternal antibiotic use during pregnancy is associated with an 89% increased risk of asthma in childhood and up to 7 years old. This comes from a report from the American College of Allergy, Asthma, and Immunology at their annual scientific meeting. We know that exposure to antibiotics within that first year, I said the critical time is before birth and up to 2 years of life. 1 to 2 courses, 3 to 4 courses, more than 4 courses of antibiotics in the first year of life doubles your risk of developing asthma by age 7. Associated with the number of courses, but it's also associated with the broad spectrum antibiotics like the cephalosporins. Increased risk with all of this. So the odds ratio, means you're a 4 times greater risk of developing asthma if you get antibiotic exposure in the first year of life. This is from a completely different study. And after the first year, your risk is still elevated, but it's not as great, only 1.5 times. So we've seen, I'm going to read this one, over the past 4 decades, there's been a significant increase in allergy, asthma, in westernized countries, which correlates with alterations in the fecal microbiota and widespread use of antibiotics. So one of the ways that we've seen this, as I mentioned already, is asthma. The prevalence of asthma so far has tripled since 1980, and it is the leading cause of chronic illness in children today. Chronic illness, and it's one of the fastest growing chronic conditions. And between 1980 and 1994, the total number of children affected increased by 75%. But the younger children, those younger than 4 years old, it's increased by 160%. So again, that early microbiome, that early developmental stage where the microbiome is just coming up to speed and just starting to affect the immune system, when we intervene at that age with damaging, noxious chemicals, particularly antibiotics, it's devastating. And this is an effect that will last for years. So asthma, we know, is actually a dysbiosis of the respiratory tract. Okay? I'm going to read this one too because I couldn't summarize this. It says, this is from the Lancet, and it said, respiratory tract dysbiosis provokes a dysregulated host immune response, which in turn alters growth conditions for microbes in airways, promoting further dysbiosis and perpetuating a cycle of inflammation and disordered microbiota. So what we're talking about here is an interruption in the microbiome, which then promotes inflammation, which then provokes more disruption of the microbiome. We call this a vicious cycle. And this is what is behind chronic inflammatory conditions, particularly asthma, inflammatory bowel disease, things like that. So this is really important. So dysbiosis, I'm going to quickly review it. I hope you know what dysbiosis is, but it's the opposite of symbiosis. Symbiosis is working together. Dysbiosis is when there's a disjointed disequilibrium. There are organisms in conflict, and this ecological imbalance means usually there is less diversity in the system. All ecosystems are based upon diversity. Diversity as diversity in an ecosystem increases, the stability of an ecosystem increases. And as diversity goes down, the ecosystems become generally less viable, more fragile, more easily interrupted in their ecological processes. Dysbiosis, as I mentioned about the microbiome, it's everywhere in the body. So can dysbiosis be. And it is directly proportional to inflammation. So the more dysbiosis you see, the more inflammation there is. In an acute place, in an acute situation, a dysbiosis can be as simple as a urinary tract infection. You have bacteria that are out of balance in the urinary tract. There's always bacteria in the urinary tract from birth onward. They are supposed to be there. They're just not supposed to be the wrong ones there. Okay? But finding bacteria in a urine sample does not mean you have a urinary tract infection. Okay? You have to have evidence of inflammation or a dysbiosis to say you have an infection. Okay? But again, acutely, we're talking about upper respiratory tract infections, sinusitis. All of these things are examples of acute dysbiosis. And that drives diversity down and it drives inflammation up. In a chronic situation, we see this in asthma, as I just demonstrated. Also in things like coronary artery disease, that drives the inflammation. Inflammatory bowel disease, diabetes, inflammation, and dysbiosis are all behind these things. So diversity, as I said, dictates the stability of an ecosystem. The microbiome is an ecosystem. We know from studies specifically in the gut that rich and balanced and diverse bacterial communities seem to be perceived as self, and they induce a quick maturation of the immune response and the gut responses. So diverse environments within the gut actually induce a tolerance within the immune system and a development of a lower level of inflammation, whereas poor, unbalanced microbiological communities in the gut are perceived as non-self, and they induce an inflammatory response. And I took out in this information, I could have told you the IgAs and the cellular mediators. Those are there. We know what those are, but I don't know. I'm not a scientist, so it's easier to communicate this. So, as I said, diversity is inversely related to inflammation, and lack of diversity or dysbiosis is associated with higher levels of inflammation. There's growing evidence that dysbiosis in the gut affects both intestinal and extra-intestinal structures, and it manifests throughout the body. Intestinal structures, easy to figure out. Irritable bowel, inflammatory bowel, celiac disease, these are examples of intraintestinal dysbioses, but you also see extraintestinal manifestations of gut dysbiosis, which include metabolic syndrome, asthma, the other things we discussed. Okay, autoimmune disease and obesity. Interesting, I mean, obesity is a big topic now when it comes to the microbiome. You all know, I assume, that we are feeding antibiotics to cattle and livestock to make them grow faster, to make them grow fatter. What do you think that does to the human, microbiome? What does that do to our nutrition when we get lots of antibiotics in our infancy? So again, diversity depends upon not only bacteria, but viruses, archaea, fungi, and parasites. Parasites is what people generally overlook when it comes to the microbiome. But eradication of parasites is very important. And we know from a very large study done in Sardinia, Italy, that when you eradicate the malarial parasite, you get severe immune system outcomes. And they did this. The Rockefeller Foundation from 1946 to 1950 decided they were going to eradicate malaria in Sardinia. It's a nice island ecosystem. You can isolate the places where the malaria, where the mosquitoes grow, they breed. You can do this pretty well. So what did they do? They dumped a lot of DDT onto Sardinia. They went to lakes, rivers, they went into homes, they spread it in bathtubs, they put it everywhere. And they successfully eliminated malaria from the ecosystem and from the biome. Okay, and we saw cases of malaria, they just dropped. Okay, going from 74,000, 75,000 in 1946 before the program began to 0 in 1952. So yeah, that's fine. We can just go out and eliminate, kill bacteria. They're bad for us, they're harmful, right? It's not going to affect us at all. Well, wrong. Multiple sclerosis virtually did not exist in Sardinia before this project took place. It was essentially 0. Went to 1.1, went to 5.8 incidents out of 100,000. By 2003, it was almost 10 per 100,000. And now, the prevalence of malaria is the highest in Sardinia as in anywhere in the world. And it's about 10, what is it? Twice as common in the than it is in the United States. And we're at a higher latitude where you should normally expect more multiple sclerosis where we are rather than Sardinia, which is in somewhat tropical range. So what happened? Well, we know what happened. A dramatically rapid change in the environment after the eradication of malaria led the Sardinian immune system to abnormal immune responses, favoring the increased incidence of MS over the last 4 decades. Eliminating a stable, commensal parasite, damaging the ecology of the system, alters the microbiome, and it alters the phenotypic expression of this disease. The genetics was there. The genetics didn't change when you spread the DDT. I mean, we know DDT is a nasty drug, but we know that this was a dramatic change in the environment. Okay, so this kind of thing, this kind of rapid environmental change can destabilize the microbiome and trigger dysbiosis and then trigger inflammatory patterns. Now they are predisposed, the genetic population in Sardinia is predisposed to that particular inflammatory condition. And all we did was we allowed that to take place. They were functioning in an ecologically balanced state. So functioning of both, we know functioning of both the innate and the adaptive immune systems depend upon the exposure to the microbiome from infancy onward. And that alterations of any of these components will affect the immune system and will affect sometimes lifelong expression of things in the immune system. And we know that the risk of allergies, inflammation, autoimmune disease, even neoplasms, even cancers will increase as a result of altering the microbiome. What causes the most damage? Well, we know already what it is. And we've just spent the better part of a century doing our unwitting best to wreck the human-associated microbiota with a multi-fronted war on bacteria and a diet notably detrimental to its well-being. And this is from the chief of infectious diseases at the VA in Palo Alto. He said, we have to stop looking at medicine as a war between invading pathogens in our body. This is not, we haven't been looking at the body as an ecology. Okay, we've been basing our medical system on the germ theory. And the germ theory says the only good germ is a dead germ. You should brush your teeth, you should, use chlorinated everything. Use Lysol on, don't touch the subway turnstiles, nothing. No bacteria is a good bacteria. And we know that that is not true. We know that the vast overwhelming majority of viruses, bacteria, even parasites and fungi are beneficial to our systems. And when you even take things away like malaria, you end up with severe problems. So the germ theory supports really a disruption of the ecology of the entire superorganism. It ignores the role that the immune system plays in resolving infection and resolving and utilizing inflammation. Inflammation is the way the immune system works. Primarily the innate immune system, that's its main MO. That's its main method of treating or responding to an infectious disease is inflammation. And we go in and quell the inflammation, throw an antibiotic, kill the bacteria, but we don't allow the immune system to respond the way it should. That's a problem. So the germ theory also neglects the microbiome. When the germ theory was formulated, and I believe it came about after tuberculosis, but when the germ theory was formulated, there was no concept that we are actually living and interacting with the environment and that the microbiome and all these organisms are actually part of a healthy and a health-promoting system, it was only, no, all bacteria are bad bacteria and they must be eradicated. Okay? So it goes against dogma, and the dogma is the germ theory dogma. It goes against dogma to think that bacteria would make our immune systems function better. But the picture is very clear. The driving force behind the immune system is the commensals, the organisms within the microbiome. And we know that infections play a very important role in our health. How do you explain that the more ill you get with acute inflammatory conditions, the more healthy your long-term health will be? It seems paradoxical. It really requires that we change our thinking about the way these organisms are interacting with us. Okay? But infections, in fact, help our immune systems mature. They help the microbiome become more diverse. As I said before, diversity lowers inflammation, generally. Infections help our bodies modulate inflammation. So I want to quickly review the microbiome here. As I said, it's a continuous environment. It's a continuous saturation of microorganisms throughout our bodies. It's vital to our growth and development. And when you have disruptions or dysbiosis of it, it generally equals inflammation, whether we're talking about acute inflammation in what we call an infection on the skin, on the urinary tract, respiratory tract. These are dysbioses, okay? Or a chronic dysbiosis like in the GI tract or in the lungs or elsewhere in the body that promotes chronic inflammation. Let's switch gears quickly to chronic disease. So we know that chronic disease is actually the leading cause of death in the United States today. It is the #1 killer of people in our country. And most developed nations, by the way. But the United States leads on this. It's responsible for 75% of all healthcare costs and the majority of deaths in the United States. Almost half of all adults now have at least one chronic inflammatory condition, and about 25% have more than one. These are the typical chronic inflammatory conditions we're talking about. There's a graph showing that it's on the right-hand side. You can see the lighter color is the number of Americans affected by chronic inflammatory conditions. And we see these numbers, since they've been measuring them, are going up. Okay? And it's estimated that by 2020, it'll be at least 50% of our population will be affected by a chronic inflammatory condition. The CDC says, well, chronic inflammation comes from lack of physical exercise or high blood pressure or all these things. That doesn't explain it. These things can definitely contribute to chronic inflammation, but they're not the cause of chronic inflammation. And they certainly do not explain the chronic inflammation and the rapid rise of chronic inflammatory diseases we're seeing in the pediatric population. Okay? They're not using tobacco. They're not drinking, I hope. So what is the common denominator? It's inflammation, it's dysbiosis, it's this thing called the microbiome. That's why the discovery of the microbiome is so amazing. This is a thing that can turn medicine on its head, because we're now realizing by discovering that the microbiome is there and that it's contributing to all these conditions that we've been doing it. We've been causing it. So inflammation has long been a well-known symptom of many infectious diseases. But molecular and epidemiological research increasingly suggests that it is also linked to a broad range of non-infectious diseases, perhaps all of them. It's becoming increasingly evident that the lack of exposure to a variety of microorganisms, especially during early life, may result in the development of diseases such as diabetes, asthma, allergies, celiac disease, inflammatory bowel disease, and obesity. According to the hygiene hypothesis, the decreasing incidence of infections in Western countries and more recently in developing countries is at the origin of the increasing incidence of both autoimmune and allergic diseases. And it's interesting when you track on the left-hand side the common infectious diseases, going down, hepatitis, rheumatic fever, tuberculosis. These are diseases that we have successfully eradicated. My God, we have done wonderful things, but look at the right-hand side of the equation. Look at what's happening to chronic inflammatory conditions. They're all going up. And what we've done in the process of eradicating these diseases, we have done significant damage to the microbiome. As I said before, you can take probiotics all you want, but that's not going to take care of the problem that you've created. We know that. We tried that. It doesn't work. Maybe by experimentation with fecal transplants, there may be some way of reversing some of this trend. That's certainly something that needs to be looked at. Unfortunately, the FDA has put the kibosh on that, so we can only use fecal transplants now for pseudomembranous colitis. So chronic disease is we see this inverse relationship between chronic inflammatory disease and acute infectious diseases. This is just an interesting slide showing that USA is at the bottom of the life expectancy tracks. We spend the most. This is a graph showing life expectancy versus health expenditure. We're pouring more money into our medical system per capita than any nation on earth. In fact, we outpace, I think you can add the 2 or 3 lower countries together, and they still don't equal what we spend here. And this is mostly going into pharmaceuticals and antibiotics. So chronic disease, it's epidemic, and it's increasing. That's important. It's related to dysbiosis and microbiome damage, and it is a chronic inflammatory situation. Now, Lyme disease is a chronic inflammatory condition. Chronic Lyme is a chronic inflammation, and that's what we're going to talk about next. And why? How can I say that chronic isn't chronic Lyme disease an infection? Well, it turns out it's really not. Chronic Lyme disease is a dysbiosis, and it's a diagnosis often based, I'd say almost always based on clinical judgment. There are no tests. There are no well-defined laboratory studies that you can say someone has Lyme disease when in the chronic stage. Yes, in the acute stage you can. Yes, there are problems with the testing, but it's more than that. We have a huge epidemic now of chronic inflammatory Lyme disease where people aren't testing positive. The tests aren't that bad. I mean, they do test some things. But we also have called this situation post-Lyme disease syndrome. Okay? And so it's a diagnostic term that we use mostly in America and in Europe for patients with persistent pain, neurocognitive symptoms, with or without clinical or serological evidence of previous early or late Lyme disease. In other words, we have a whole group of people, we can't figure out what to do with them, we can't figure out what to call it, we can't prove in many cases what it is. Okay? But there are certainly strong evidence that it is related to at least Lyme infection at some point. We see higher incidence of this in Lyme endemic areas. And despite the resolution of the objective manifestations of infection, meaning the test results show that you're clear of it, manifestations of infection after antibiotic treatment of Lyme, a minority of patients go on to develop fatigue, musculoskeletal pain, difficulties of concentration, short-term memory, or all these symptoms. And once you make the diagnosis of chronic Lyme disease, it's pretty common that people go on long-term courses of antibiotics. But if chronic Lyme is really a dysbiosis, what's going to happen if you give them more antibiotics? And there have been great studies. Well, it's questionable whether there have been great studies. There have been studies done, published in journals like New England Journal of Medicine, looking at long-term treatment of Lyme, post-Lyme disease. And we don't see clinical differences between the placebo groups and the groups treated with antibiotics. We don't see it. Even when there are neurologic manifestations of Lyme, using IV ceftriaxone, they result in short-term cognitive improvements, but the cognitive improvements disappear once you stop the antibiotics. Well, why? That doesn't make sense if it's working, right? Doesn't that prove if you give an antibiotic and someone with an infectious disease gets better, doesn't that prove that the antibiotic was killing the infection? No. We'll talk about that. So there really is very little benefit from we don't have objective criteria of any significant benefit for using antibiotics long-term in chronic Lyme cases, okay? And there is considerable risk of harm from using antibiotics. Okay? We know antibiotics impair the immune system. This is from Goodman and Gilman's Pharmacological Basis of Therapeutics. This is the Bible of pharmacology. Okay? And it's one of the things they said about antibiotics is they affect various host immune responses adversely. They alter and impair leukocyte chemotaxis. This is how white blood cells move around in the body, impaired by antibiotics. They affect lymphocyte and monocyte transformation. This is how cells in the immune system begin to recognize foreign agents and change their structure and their physiology to adapt to them. Impaired by antibiotics. Impairs antibody production. This is kind of important, don't you think? When you impair production of antibodies. So these are all things that antibiotics do, okay? And they also affect phagocytosis, which is the way monocytes chew up and digest different bacteria that they're trying to eliminate, and the action of polymorphonuclear leukocytes, which are just white blood cells, again, acting and supporting the immune system. But antibiotics do even more than that. There's a non-antimicrobial effect, which is called an anti-inflammatory effect, that we know is there, okay? So just taking an antibiotic acts as an anti-inflammatory. It acts like aspirin or Motrin or an ibuprofen in your system, so you will feel better while you're on the antibiotic. You think, wow, I'm feeling better because it's killing all these nasty bugs and I'm getting healthier and healthier. No. You're actually blinding your immune system, turning off the lights, putting on a blindfold, and running around in a barn. All right? It is not helping your immune system. You are experiencing anti-inflammatory, and as we said before, remember, inflammation is the first arm of the immune system. You're cutting out inflammation. You're blocking inflammation. That's not good when you have an infectious disease. So antibiotics, we also know, as this is again review, it worsens dysbiosis, it favors chronic inflammation. And in my clinical experience, most cases of chronic Lyme disease that I've seen in my practice have a history of chronic antibiotic use that far anteceded the acquisition of Lyme. So we're not just talking about people who came in for Lyme disease who might have been overtreated with antibiotics, but these tend to be people who have been treated for acne for years with the tetracyclines, or they were treated with multiple childhood infections, and the immune system was damaged early on. Lyme disease is just an opportunist. It just came along and, wow, we've got an impaired immune system. Let's go to work. Okay? Also, what I see in my practice is most cases of chronic Lyme who do undergo antibiotic treatment, you see this chronic spiral down. And I challenge you all to, when you see people with chronic Lyme, take a careful history. When did your condition start? You know, when was the tick bite if you're lucky enough to have that? What were your symptoms then? Okay, after your first course of antibiotics, you felt better, right? What were your symptoms then? And they say, oh, you know, I just started with aches and pains, and now I'm getting some joint pain. And each stage of antibiotics, you actually see the disease progress. And eventually it's affecting the central nervous system. Usually not the first time unless they have a history of antibiotic use before that. Okay? But you see this spiral down. And they get more antibiotics, they feel good, this is great. They come back a couple months later, their symptoms have recurred, and now they're adding a new symptom. Now they've got fog, or now they've got, you know, some palpitations, or now they've got something new. And we see this again and again and again. And we think we're getting better because we felt better when we took those antibiotics. But then they wear off, the microbiome recalibrates, but it's dysbiotic, and it's more dysbiotic. And now there's more inflammation, and the inflammation's getting deeper. So the risk of co-infections, I also see this. This has never been published anywhere, so I probably shouldn't show it. This is not, I don't have anything to back this up, but in my practice, I have seen co-infections go up as the courses of antibiotics increase. This would be an example of dysbiosis, if we can prove this, because that just means that we're seeing opportunistic organisms. Babesia is a fairly benign organism left to itself. But when you add it to the mixture of chronic Lyme and dysbiosis, it's now invasive. It's now much more aggressive. So, what is chronic Lyme disease? I believe it is chronic inflammation, chronic dysbiosis of the microbiome. How do we solve this? Well, you can keep giving antibiotics, and that's what some organizations recommend. Just keep giving antibiotics. Put them on antibiotics for life. You can give probiotics, but they don't work. You might try fecal transplantation. I would love to see some studies showing whether fecal transplantation actually can fix part of this dysbiosis. I suspect there's something there behind it. You can suppress it, you can give anti-inflammatories, or you can throw away the germ theory and shift your paradigm. And that's where we're going right now. Okay? So this is an interesting, this is a statue of Samuel Hahnemann, who is the physician, the German physician who codified, he put together this structure that we now call homeopathy. And this is a picture of his statue that is in Washington, D.C., in our nation's capital. It is the only statue of a physician in our nation's capital. And that alone should say a lot. I guess you can get to Washington many ways today. But at the time when the statue was put up, there was a huge amount of respect for Samuel Hahnemann. There were homeopathic hospitals in the United States. There were homeopathic sanatoriums. There were homeopathic physicians all over the place. And the reason for this is they were benefactors who had been treated homeopathically, who saw the results, their family felt the results, and they supported homeopathy, and it was actually a thriving medical specialty until the AMA got a hold of it, and the Flexner Report, and these other economic forces that drove homeopathy down. But homeopathy is still utilized throughout the world. It's integral to the healthcare systems of some countries, including India. It's part of the public health service in the United Kingdom. It's used throughout Europe. It's estimated that about 500 million people utilize homeopathy worldwide. It's been around for about 200 years. And we believe today that it's a form of nanomedicine. And this is from I think one of the great researchers of our time, Iris Bell. She said, ironically, one of the most controversial systems of medicine, because homeopathy, we're here at an integrative symposium, but homeopathy is really not accepted even here. We're really kind of absolute fringe. And again, thank you very much for inviting me. I'm very pleased to be here. You'll probably never invite me back. But it's ironic that one of the most controversial systems of medicine, homeopathy, could turn out to be one of the oldest and demonstrably safest forms of nanoparticle-based treatment already used worldwide for infectious diseases. It's already in place. It's already being utilized. Historically, homeopathy has had a problem because it's been interpreted along a vitalistic and a spiritual framework. Well, no surprise. Hahnemann lived in a time where there was no concept of microbiology. No one even had discovered, I think Van Leeuwenhoek had just discovered organisms in pond water, but no one had put together, and this was also just before Pasteur's time, no one had put together that these organisms were valuable. That took till very recently, but we didn't even know they were there. So of course Hahnemann had to phrase it in a vitalistic framework. There was a vital force working inside the body. And we know today that that vital force is probably part microbiome, part immune system, part of things that we didn't have a concept even existed in the 18th century. We believe that homeopathy is a form of adaptive network nanomedicine. And I have to read this one because I think it's fascinating. Using transmission electron microscopy, electron diffraction and chemical analysis by inductively coupled plasma atomic emission spectroscopy, the presence of physical entities in extreme homeopathic dilutions in the form of nanoparticles of the starting metals and their aggregates has been confirmed. Homeopathic medicine we've been fighting for credibility for so many years because no one could explain how homeopathy worked. And now the most advanced spectral studies and electron are finding traces of nanoparticles of the original substances in all homeopathic dilutions. Everything from 30C to 200C. We're talking about dilutions ranging from 10 to the 60 to 10 to the 400th power. Okay? Many orders of magnitude beyond Avogadro's number, and theoretically, these particles should not be there, but they are. So there are observable nanoparticle forms, particulate forms of source material and silica in all homeopathic potencies. Well, why silica? Well, most of the medicines are made from shaking, diluting, and succussing medicines in silica, in glass, in borosilicate. Okay, so yes, you're going to actually knock off silicate nanoparticles as well when you do this process, which just confirms that the process of production of these substances, these medicines, is actually what's doing it. Okay? So nanoparticles are very small, okay? 1 to 100 nanometers in diameter, and a nanometer is a billionth of a meter. It's like several atomic atoms. It's pretty small, okay? They're made either by top-down milling or bottom-up assembly. The milling process, when you triturate homeopathic medicines, can be forming nanoparticles as well. And they can be bottom-up assembled just by a natural process in nature, too. Nanoparticles are very interesting because this is actually a discipline of medicine today, studying nanoparticles and nanomedicine. And we know, not even looking at the homeopathic research, but at the nanoparticulate research, that the nanoparticles exhibit a lot of superior qualities to conventional bulk drugs, okay? They're higher antioxidant effects. When you take an antioxidant, I'm blanking on one right now, but you dilute it and you make a homeopathic medicine, the antioxidant effect in the bulk agent it's much higher in the nanoparticulate form, which is not what you'd expect. You'd expect, of course, you're giving more of it in the bulk form. You should be giving a fraction of that antioxidant effect. It is reversed, okay? Nanoparticles are more effective drug delivery vehicles, and that's why they're such a hot area of research today. They're more effective in delivering drugs than conventional bulk form drugs. They reach selective targets. They seem to target certain cells and leave other cells intact. And this has been observed and studied in cancer research, where the nanoparticulate forms actually enter the cancer cells and they leave the normal cellular tissue alone. Okay? They reduce the total dosage that you need, and they cross the blood-brain barrier. They have distinct advantage, as I said, as they target specific cells. Their doses last longer. Why would this be? Why would the dose of a small particle last longer? Well, these are structures that are so small, they're not even chemical anymore. They're way subchemical. And the body is working to eliminate chemicals. It can eliminate non-steroidal anti-inflammatories. It can eliminate things like that in a chemical form much more easily than it can in nanoparticle form. They persist in the body, which has potential downside, too. Don't believe that homeopathy is completely safe. Okay, there are potential downsides. We need more research to know where this begins and ends, okay? But this is a real phenomenon, okay? And the therapeutic effects are magnified up to 1,000 times. It's, as I said, if you take a non-steroidal anti-inflammatory and give it, or a nanoparticulate form of the same thing, you're actually more potent in the nanoparticulate form of the non-steroidal anti-inflammatory. Okay? They have multiple selective effects, as I mentioned, in cancer therapy. Nanoparticles induce apoptosis, which is cellular death, in diseased cells, but not in healthy cells. They have anti-inflammatory, antioxidant, and immunomodulatory effects. And they also affect bacterial, viral, and fungal infectivity. There are reduced side effects generally from nanoparticles, greater efficacy, definitely lower costs. At high doses, we see that nanoparticles start acting like pharmacological agents. So if you give too many of them, they will eventually have a drug effect. Okay, so there's caution here. At low doses, they do something completely different. They induce a non-pharmacological, adaptive, hormetic response, and hormesis refers to a non-linear process where we see inhibition and excitation depending upon dosage. That's hormesis. So as you can take an inhibitory drug, reduce the amount that you're given, you can actually see that it transforms from being an inhibitor to a stimulator. Okay, this is a law of pharmacology, hormesis. And you see hormetic effects when you look at nanoparticles and endogenous amplification mechanisms. That middle word here, adaptation, is so important because this is beginning to enter this new field that we know, or this new concept of actual healing. What is healing? Well, when you stimulate an adaptive process, in my mind, we're beginning to talk about real healing, not just drugging, not just inhibiting, not just hiding symptoms, not just managing a disease, but now you're talking about a cellular living system that's beginning to adapt based upon a treatment that is probably giving information. We're talking about minute particles that enter, they cross the blood-brain barrier, they cross the cellular membrane. For all we know, they get into the nucleus of the cell. We're talking information technology here in nanomedicine, okay? They support the patient's adaptive network, leading to functional self-reorganization as a biological network, and host expression of a more robust cellular defense system against infections and other stressors. So, very quickly, homeopathy, it may be the world's oldest form of nanomedicine. There are thousands of published cases worldwide. There is extensive research on homeopathy worldwide. When you hear someone say, homeopathy, there's no research, there's a lot of research. If you even go to the American Institute of Homeopathy website, you'll see citations for over 6,000 articles on homeopathic research. There are lots of studies, but it doesn't matter how often you wave a study in front of somebody if they're convinced a priori that it couldn't possibly be true. It couldn't possibly be the case. How can you possibly give a medicine that has nothing in it and create a physiological effect? Well, we know. Now we know. But still getting anyone to read these things is not easy. It's very difficult. And we do see demonstrated effectiveness in a wide range of clinical conditions, chronic, acute, chronic, and infectious diseases. I'm going to go through maybe just a couple because I want to give you an example of this. Okay, so looking at malaria, using homeopathic medicines, we see that we can actually inhibit the growth of the malarial parasite. Okay, looking at different viruses. This is actually, I believe, no, this is actually still using homeopathic preparations. We have seen that we can affect the infectivity, the virility, I don't know the other word, the virulence, thank you very much. We can affect the virulence of viruses using homeopathic preparations. Okay, in HIV/AIDS, we have seen multiple studies looking at the effects, including lymphocyte counts, quality of life, and HIV viral loads using homeopathic treatments. There is plenty of research. No, there are not studies with hundreds of thousands of people as participants because there's not very much funding in the homeopathic field for these things. And like myself, most homeopaths are clinicians. We work in the trenches. You should be aware of this study. This study, no one could get this study published in a conventional peer-reviewed journal. It was eventually published in a homeopathic peer-reviewed journal called Homeopathy out of the United Kingdom. But what they did in Cuba is they made a homeopathic preparation of the leptospirosis organism. And they gave it to 2.3 million people in the endemic regions of Cuba that had a annual leptospirosis epidemic. And they saw significant reductions of incidence in the intervention regions as opposed to significant increased incidence in the non-intervention regions. They were giving an oral dose of a homeopathic medicine made from the leptospirosis organism. Okay? And as a result of the study, they saw the incidence of leptospirosis fall below historic means ever since it's been tracked. Okay? Looking at chronic disease, and that study is published. If you go to our website, you can find the citation for it. There it is, published in 2010. It's phenomenal. Chronic disease, looking at a group over in Europe, Switzerland, Austria, Germany, looked at, did an 8-year cohort study with almost 4,000 patients looking at chronic disease and what were the effects. The chronic diseases they looked at included migraine, tension-type headaches, sleep disorders. All of these things were part of what the people brought in when they were being treated homeopathically. And they wanted to know what was the effect of treating long-term with homeopathic medicines, because if it's really placebo, that effect will wear off after a couple months, maybe a year at most. So in an 8-year study, they saw that the disease severity decreased significantly, and the physical and mental quality of life scores increased. And what I find most interesting about this study is that these factors, younger age, female gender, and more severe disease at baseline, were the predictors of a positive therapeutic response. So I would expect that a less severe disease is going to predict a good response or a better response. They found the more severe disease when you entered the study, the more likely you were going to actually respond to the homeopathic treatment. This should have been headline news. This is important. It was buried. And it was published in BMC Public Health. It wasn't even published in a homeopathic journal. So again, to review quickly, homeopathy is an adaptive network nanomedicine, and it directly impacts the microbiome. Well, how can I say that? Well, we don't have a lot of research for me to say that, but I have one study, and that goes back to 1936. And there was a guy named John Paterson in the United Kingdom who was doing research on a group of remedies, a group of homeopathic medicines called bowel nosodes. And he and a gentleman, a physician, both physicians, the other one was named Edward Bach, who became the physician who developed the Bach flower remedies. But they were looking at the gastrointestinal tracts. They were looking at the organisms that grew out of people's stool when they were sick and when they were healthy. This was the first microbiome research that was done. Okay? And he found that when you treated people with homeopathic medicines, you altered the flora of their stool. How did that happen? But so we do know, at least, and I would love to see this verified. This is something that should be verified today. We should be looking at this. Okay, but this is extremely important. If we're talking about diseases of chronic inflammation coming out of the microbiome damage, and you can affect the microbiome with a nanoparticulate formulation that affects the flora of the stool and who knows where else. And actually, homeopaths will tell you, just from clinical experience, that we can affect the microbiome anywhere on the body. I can affect the microbiome in the urinary tract when I treat someone with a urinary tract infection and they improve without an antibiotic. I can guarantee that I've affected the microbiome. Same thing respiratory tract. Same thing anywhere in the body. So we know that this is happening, and the science is trying to catch up with the clinical experience. So I wrote this. The judicious use of the classical homeopathic method has proven itself clinically effective in preventing and treating illnesses like Lyme disease. I've been working in the Northeast in an endemic area where Lyme exists for the last 20-something years. I don't even want to count. But I have seen clinical success using only homeopathy in most cases of acute and chronic Lyme disease. So let me give you an example of that. Okay, let's breathe for a second, and before I do this, are there any questions? Uh-oh. Go ahead. Does the microphone work? Try that. Just a couple, and then we'll stop at the end too.
Have you ever done done any CDSA testing before and after, just to see in your own practice if there's a measurable lab effect?
You're asking, the question is, have I ever done any
CDSA
testing
lab testing
with my, you mean because I should be using my research grant to do that testing?
I'm just asking if you have and if you've seen any of that.
No, because you remember, again, part of the testing that we have for Lyme is antibody-based. A lot of the testing that we use is just measuring antibodies to Lyme. And unless you're going to use the ones that are the magnification techniques. But no, what's most important for me and what's most important for the patients is how they feel. And determining, I don't really care whether the test still shows they have Lyme or antibodies to Lyme or even Lyme bacteria, because I know that the microbiome, if it's healthy, is going to be balancing that bacteria in the system. Okay? Lyme, I don't believe, is a new bacteria. I don't believe it was created by Plum Island researchers who released, government. I don't think the government's that smart, quite frankly, to develop a Lyme bacteria. In a normal, healthy immune system, Lyme is perfectly okay, and people are healthy. When you go out and measure the antibodies to Lyme in healthy populations in Block Island, Martha's Vineyard, and Nantucket, you find that 25% of adults have antibodies and evidence of exposure to Lyme, and 50% of kids have it, but they're not sick. So I don't really care whether the test shows they have Lyme or not. I want to know whether the person feels better or not. I haven't done it. Thanks for asking, though. Yeah, one more question and we'll move on.
Is this working? Okay. So as far as the homeopathy inducing apoptosis, that's what I was really interested in. Do you know the mechanism behind that?
No, I'm sorry, I don't.
Okay, and the second question I have about that...
I don't know the mechanism of how the nanoparticles or the homeopathy induces apoptosis. I don't know. Okay.
And then... is there any evidence that homeopathy induces apoptosis in cancer cells?
Yes. Yeah, that's what we were talking about. It is homeopathic medicines that induce it. That's what the studies have shown.
Is there specific formulations, or is that...
There's a group called the Banerjees from India. It's a family. I think 3 generations of classical homeopathic physicians have worked using homeopathy and only homeopathy, and they have a clinic that they treat many, many cancer patients, and they have dramatic results. And they came to the United States. The National Cancer Institutes, I believe, actually sponsored a Best Cases series a number of years ago. I think it was back in early, 2006, 2008. And they looked at all the data from the Banerjee Clinic and said, which medicines are you using? What's working? And they looked at all their protocols and they said, there's something here. There's something behind this. We cannot explain this, but this seems to work. That was the last we ever heard of it. No research has been done to follow up on the National Cancer Institute's recommendations that it be looked at. And in terms of the protocols, I can't tell you what they are, but if you look up the Banerjees and cancer, you will have access to that. And just incidentally, the American Institute of Homeopathy, which is the oldest medical society in the United States. We predated the foundation of the American Medical Association by about 3 years. We sponsor conferences on this type of thing on an annual basis. So look into our website, do a search. Nancy?
Thank you.
MD Anderson.
Society of Integrative Oncology. I can't think of his name. He did a one-year study on breast cancer.
Yeah, she's saying that MD Anderson in Texas. A physician named Moshe Frankel at MD Anderson in Texas did a study of homeopathy and breast cancer. Is that ongoing right now?
No, but it was several years ago.
Okay.
Presented at the Society for
Okay. It's been presented. It should be cited in the literature.
Remedy.
Okay. Thank you. So let's move on. Let me give you this case, and then we'll be summarizing after that probably. Okay. So a case report of Lyme. This is a 92-year-old gentleman who came to me a couple years ago, a retired physician, presented with complaints of chronic Lyme disease. Okay, he said he'd received multiple tick bites over the previous year, and he was, of course, living in a Lyme endemic region. His initial treatment before he saw me was doxycycline 100 twice a day for 28 days, followed by ceftonir 600 daily for an additional 26 days. And he noted that he felt better initially, but as soon as he stopped taking the antibiotics, his symptoms began to recur. And this is a quote from Samuel Hahnemann, who you saw his statue earlier on, the one that's in Washington, D.C., and I felt it was apropos. He said, "These treatments, likewise, do nothing but debilitate and only suppress or suspend the malady for a short time without being able to cure it. And when used for a long time, they always add a new morbid state to the old disease." And this is what we're talking about. If we're dealing with a dysbiosis, this is exactly what we would expect. And Hahnemann said this way before there were even antibiotics. Okay, way before we even knew what the microbiome was. So it's essentially saying that this kind of treatment can temporarily help you feel better. It can suppress the symptoms. The antibiotics, as I mentioned, can act like anti-inflammatory medicines. They can make you feel better, but they essentially impair the immune system. They damage the microbiome, okay? And they can worsen dysbiosis. So at the time of that consultation, these were his symptoms: brain fog, depression, vertigo that was worse in the morning after rising. Now, a footnote here. I practice classical homeopathic medicine. There are different ways of practicing homeopathic medicine, just as there's some slightly different ways of practicing conventional medicine, but it can be utilized in different methodologies, and most of them seem to have some form of benefit. I utilize classical homeopathic medicine because it's a more in-depth interview, and I find it more helpful in individualizing the treatment and helping me individualize the patient. Okay? And so in a couple places I put things like, well, worse after rising in the morning, because that is one of the things that a homeopath will use. We will look at the modalities of a symptom. Vertigo is not a helpful symptom. Lyme disease is not a helpful diagnosis when you're treating with homeopathic medicine. We need to know specific information about the Lyme disease or about the vertigo or really about any symptom. And we don't treat on the basis of disease, pathology, or diagnosis for the most part. That we treat on the individual basis of the characteristic symptoms and the totality of the person who is presenting with the illness. And we find that that vehicle, that person, that ecology is more important than the name of the disease, which would make sense in a system where you understand that the cause of disease is the microbiome, not just some genetic malfunction. The genetics are there anyway, but it's the environment that helps bring these things out. And it's the microbiome that may be dysfunctional that's leading to these situations. So you want to know as much as possible to individualize the treatment. It's like threading a needle. If you just poke it somewhere, you have to use a baseball bat to hit the needle, right? But when you're using a nanoparticle, you want to be very accurate at where you're putting that thread. Okay, and that's crucial to understanding. I know I'll get more questions. Which medicines did you use? What are the Lyme medicines that are going to be helpful to me in my practice? The answer is, I can't give you that answer. It depends upon the person. And I'll probably say it again a couple times. It depends upon the person. There's no Lyme medicine. Okay? So, is that clear? Nausea is another symptom. Intolerance of spices and fatty foods. Again, who cares? Well, I care because this helps me navigate which medicine is going to be helpful. He prefers warm environments, fresh air. He was experiencing a clicking in his neck whenever he moved his neck, night sweats, fatigue. He said it was such a great effort to do his desk work, to even get up. He hadn't gone outside for 2 months. He remained indoors. General weakness with lack of energy. His medical history was remarkable for a history of urinary complaints with chronic urinary retention, hesitancy, incontinence, nocturia, probably we know there's some prostate problems, as you'll see, and a recent urinary tract infection, which he treated himself using ciprofloxacin. Remember, this is a physician. He had ready access to any antibiotic whenever he wanted it. And a lifelong history of recurrent antibiotic use because he could get to antibiotics so easily. And any sign of a cold or a sinus infection, he'd start taking antibiotics. He also had irritable bowel. That's a big surprise. And gastroparesis. He had chronic recurrent sinusitis, as I mentioned, which he treated again and again with antibiotics. I mentioned earlier, if you remember, that in a lot of the cases that I see in my office, I can document a history at some point in the life, and the people who are stuck with chronic illness, not the acute people, but the people who have the chronic, incurable type of disease, that they have abused antibiotics at least one point in their life, either in their childhood, maybe as an adolescent, and maybe even recently by being overtreated for Lyme disease with antibiotics. But this guy was a good example of that. He had definitely used more than his share of antibiotics. He also had a hiatal hernia, and he was osteopenic. He had degenerative disc disease of the spine. As I mentioned, he had prostate cancer. He was status post-radiation and chemotherapy. He had a triple abdominal aortic aneurysm. Physical exam wasn't very helpful. And laboratory, I'm glad you mentioned the laboratory question. Laboratory help wasn't really helpful either. I mean, if he showed a positive result for Lyme disease, I'd say, oh yeah, he's got Lyme disease. If he shows negative, what do I know? All I know is he has the history, he's living in a Lyme endemic region, and he's got a lot of symptoms. And I know that might be antithetical to a lot of our medical training where capturing that diagnosis is so important, but we're seeing people today that are falling between the cracks of diagnoses. We have people who you cannot confirm a diagnosis on. Chronic fatigue, fibromyalgia, chronic Lyme disease, where we really are more often not sure what's going on here. And there's this whole mess of things that are microbiome related, okay? And we can usually document big problems with the microbiome. And people are, as you know, you're testing your clients for microbiome damage, and you're seeing problems, right? Okay? So he was tall, thin, frail, very thin guy. He had he looked older than 92. He was really frail. He had a concave chest, pectus excavatum, pale skin. He wasn't really in any distress that I could tell, and the rest of the physical exam wasn't really helpful. So my diagnostic assessment was, A, the guy has totally over-abused antibiotics, and this was showing up in inflammatory bowel disease, chronic sinus infections, again a dysbiosis, and chronic Lyme disease or some kind of post-Lyme disease syndrome. I don't care if it's post-Lyme or just chronic Lyme. It's still the same thing to me. And in fact, as I said, the diagnosis is not important. It's the symptoms that help guide the treatment here. So clearly he had a dysbiosis, and the dysbiosis was leading to chronic malabsorption, right? Wouldn't it? If you're not absorbing well, what are you going to get? Well, over time you'll develop osteopenia. You're going to be fatigued if you're not getting the nutrients you need. What did I do? And this is going to frustrate you all. I'm sorry about that. But I gave him one single dose of a homeopathic medicine. 200C preparation, which means it was diluted and succussed 200 times, that all we have left here in this preparation are nanoparticles. And I gave him one dose by mouth, and I said, bye. Okay, talk to me in a month. So, as I mentioned before, choosing that medicine, deciding on what he was going to receive, was not based upon the diagnosis of Lyme disease. It was based upon the total clinical pattern, what we call the totality of his symptoms. Okay, looking at from head to toe, looking at the bladder symptoms, looking at what we know is going on with the gut. Okay, and it relies upon here's the other catch. It relies upon the individual's salience. It relies upon the ability of their immune system and their microbiome to regenerate. I'm not feeding them a new microbiome. I'm not feeding him a new immune system. Like apoptosis, when you are somehow stimulating, cellular suicide in cancer cells, which is what apoptosis is, you're stimulating some kind of an adaptive immune response here with the medicine that matches the totality of the symptoms. Like looking at the hologram, you find the corresponding treatment, and there's this process that takes place. Yes, we know it involves the microbiome. Yes, we know it involves the immune system. But what's the mechanism? I can't tell you that. Okay, so it does definitely depend upon the host, the individual who is ill, to stimulate that recovery. And when people have been treated and treated and treated and treated and treated and treated, their response time is slower than when they have only received a couple of these suppressive treatments or a couple conventional treatments. Children respond dramatically fast to homeopathic medicines. Adults, the longer someone's been abusing their bodies, it would make sense that their innate systems are going to be more broken down and will respond slower. And that's generally what we do see. But again, to remind you about that study, that 8-year cohort study that looked at the response to homeopathic treatment, it was also those who had the most severe disease at onset that responded the best to homeopathic treatment. At 1 month, he said, I'm doing much better. The nausea is now mild. It's worse in the morning after I rise, better by noon. The vertigo is only once in a while, and usually with nausea. He still felt like his head wasn't level-headed or even-keeled. His nocturia had improved. I gave him a different homeopathic medicine. 1 dose by mouth, 200 C. And again, it's going to depend upon the person. Okay? So there's no, here's the magic key to Lyme disease. No, there's not one single medicine that will do it. In fact, many medicines can do it. 3 months later, actually 2 months later, so it's a 3-month follow-up, I'm very pleased with the last 6 weeks. Gradual improvement in my energy. Gradual. Well, of course. I mean, his system is rebuilding. No nausea, no more GI distension. This is a guy that was diagnosed with gastroparesis. His stomach and his digestive tract are working better now. We know the microbiome's involved now. No recurrent sinusitis, no further urinary tract infections, no vertigo, no brain fog, no more urinary incontinence. And he said, how do you discourage old friends from staying too long? That was his main concern. 1 year follow-up. No recurrence of his symptoms. No repetition of medicine. He only got 2 doses of a homeopathic medicine, and he now feels strong and fit. And from his perspective, he said, I'm doing very well for age 94. I have no complaints. If I continue how I am, I'll be very satisfied. So, to quickly review homeopathy, we think it is the oldest form, continuously utilized form of nanomedicine in the world. It requires a paradigm shift away from the germ theory. You have to get your mind off this idea of killing bugs and sterilizing your environment. This does not benefit the ecology of your bodies. And Hahnemann, one last time, said, I didn't want to hit you with too many quotes from this guy because they're pretty archaic, but he said, it was high time to put a stop to these abominations, to command a cessation of these tortures. In place of curing patients, to render them incurable by the addition of new chronic medicinal maladies by means of the prolonged use of the wrong and powerful medicines. And I want to remind you of that graph that I showed you that showed the increasing incidence of chronic inflammatory disease in America. That we're seeing this across the board in all age groups, in all socioeconomic groups, in everyone who's using conventional medicines. We're seeing a rapid and a prolonged elevation of chronic inflammatory disease. Something is wrong with the germ theory, and we know what it is. It's the microbiome. It doesn't fit. So homeopathy seems to promote resolution of inflammation, resolution of dysbiosis, integration of the immune system. There's more than just getting the immune system tuned up and the microbiome tuned up. They must be integrated. The whole idea of health involves an integration of these systems. Why not use a system of medicine that has a proven track record for doing this? And it helps restore health. The good study would be, let's do the testing before and advance. Let's see what the tests show. But we know that there's a response. Homeopathy is effective in a very wide range of clinical conditions. These are just a few. And my God, I think the most important thing is it is ecologically sustainable. That we're not polluting the environment to make these medicines. We're not cutting down rainforests to get these rare things. Homeopathy is extremely sustainable. It is non-polluting. It's holistic. We know it's compatible with the microbiome and the immune system, and it's dirt cheap to make these medicines. Okay, so finally, we know the human microbiome is an ecology, and it is involved in every level of human growth and development. That the epidemic of chronic illness seems to be an iatrogenic side effect of the use of conventional methodologies. And there's wonderful things about modern medicine. I'm not trying to condemn it all. There are wonderful things that we are doing with conventional medicine. But we are overusing antibiotics, overusing anti-inflammatories, overusing opioids, overusing. Conventional medicine should be a second-line form of therapy, and something like homeopathy should be first line because it is so much safer. When it doesn't work, you can always resort to the antibiotic. If someone is dying, if it's a severe accident, trauma, yeah, go ahead. We have the best trauma care in the world, but we have the worst chronic care in the world. I could show you tables of that, but you've seen them, I hope. The germ theory has limited application, and it does promote microbiome and immune system damage and dysbiosis. And I believe Lyme disease is a good example of a chronic dysbiosis and a chronic inflammatory disease. Homeopathy, again, is an adaptive system of nanomedicine, demonstrated efficacy in a wide range of conditions, worldwide use, safe and effective. And what we're really getting, what we really should be taking home from all this research on the microbiome is that yes, it's important to be able to fix it, but wouldn't it be nice to have a system of medicine where you don't run into microbiome problems, where you can treat children, infants for these imbalances, these dysbioses, without creating further problems down the line? And that's where homeopathy fits so nicely into that scheme. It should be integrated into the conventional system of medicine. And we need to investigate it. The Microbiome Project has given us direct evidence that the homeopaths have been working in the right direction for over 200 years. So, finally, and then I'll stop. Iris Bell. Rather than rejecting the entire field of homeopathy from its original vitalistic interpretations, it's time for modern scientists to examine seriously the nanomedicine implications of Hahnemann's empirical findings for integrative healthcare. And that's the take-home. The AIH, we have some information in the back if anyone wants it. There's an article also on the emergence of nanomedicine and homeopathy. It's very important if you guys want some data. But remember that we're talking about a rainforest. We're talking about the diversity of a rainforest and a system of health and ecology that is so intimately linked that we can't just walk around like a bull in a china shop and expect we're not going to cause long-term problems. We have to act responsibly on a macroscopic scale with our environment, and we've got to act responsibly on a microscopic scale with our health. Are there any questions? Yeah. Thanks.
Hi. I have a couple of questions, but I've been a long-term user of homeopathy.
Abuser of homeopathy?
No, user.
Good, okay.
I try not to abuse it. I'm a closet homeopath, but I'm Chinese herbalist and acupuncturist, so kind of fit in somewhere. One thing that's often encountered in homeopathy is really nailing that remedy, right?
Yeah.
So, I mean, this is a beautiful, case where it was like two different remedies. But what is your typical, course with the patients? How often do you see them? How many remedies usually takes? not everybody gets better. There's different layers.
Yeah. Next question. It varies. You know, what is the typical course of treating someone with Lyme? They've been some of my most challenging cases. Some of my most dramatic failures have been Lyme disease. And some of the most, brilliant successes have been Lyme. Everybody is different. And one of the guidelines that I think about and that I try to remind my clients about when they're starting therapy is that, yes, every case is different, but the longer and the more damage that's been done to the rainforest, the harder it is to reconstitute it. And, when you go out and you strip, and you reduce biological diversity within your microbiome to such a degree where you're at a fraction, of the operating speed of these organisms, it's really tough sometimes. And I've seen dramatic failures as a result. And that's why I think we need to look at it also from maybe a microbiome transplant or a fecal transplant is going to be something that gives us more of an edge here. I don't know. But everyone's different. And some people have said, one dose, one medicine was it. And other people I've worked with for years, they are improving.
Okay.
And most people improve. Again, as you said, finding the right medicine is key. It's not here, you take this one, you take that one. It's not random, and you can't assign it by diagnosis, unfortunately. That's where, modern medicine is so tremendous because it makes itself so easy to use. You got a headache, here's the medicine. We know what to give you. Lyme disease, we don't know until we sit down and really get into what's going on.
Okay, my second question is, do you find applications for herbal medicine as a classic? I'm a classical Chinese herbalist, so I prescribe, herbs for my patients. And I don't know if you're familiar with the work with Heiner Freuhoff out of Oregon, who does, tremendous work with, Lymes from the perspective of Chinese medicine. So I was just wondering.
I have not. No, I don't use herbs. I use homeopathic. I use lifestyle. We talk about diet. We talk about many, many things in addition to the homeopathic medicines. We want to reduce things that are causing problems. I want to keep people off of future antibiotics. So I'm working with any acute infection that comes up that they might be tempted to take an antibiotic for. I'm working in a lot of different ways, but I'm generally not prescribing herbs or nutraceuticals for that. Okay, thanks for your question. You're not allowed to ask a question.
Thank you, Ron. Great presentation and validated a lot of points that I also see in the clinical practice. My question is a concomitant use of homeopathics and nutraceuticals, and how do you keep, do you use nutraceuticals, or are you allowing your patients to use nutraceuticals when they are on homeopathics?
What I do generally is I will review their nutraceuticals, and I might occasionally suggest a vitamin or a mineral or nutraceutical, depending upon the individual case. Depending upon if this guy was anemic, in addition to everything else that's going on, yeah, we would be talking about vitamin C and iron and other things that are going to help provide the basis for that. I'll always recommend probiotics, even though I know they're not much help. I'll always recommend naturally fermented foods, living foods, because I know that they're going to provide some basis of recovery, but not a lot. So yes, I'm constantly looking for other things that are going to fit into that jigsaw puzzle, but primarily it's finding the right medicine. But there's always going to be factors that, in addition, that will work.
You're not against the whole food supplements?
I'm not against them at all, no.
Okay, and how about the herbs?
Herbs, I generally stay away from them, and mostly because perhaps my bias is that many herbs are more symptomatic based, that they may be making someone feel better, but if you stop the herb and they're back, that tells me that you were just suppressing the symptom. And I need to know, as a scientist or as a clinician, I need to know the full extent of the symptoms if I'm going to prescribe accurately. So I don't want anyone on anti-inflammatory medicines. I don't want anyone on any herb that's going to be hiding symptoms. I really want to see the worst. I want to know where they are really bad and what is really, you know the word. I'm not going to use that word here. We're looking for the deepest pathology. And because in the homeopathic system, we actually cure, or we think we cure. The theory is we are curing from the inside out. And so we want the deepest part to, when that starts improving, we know that these more superficial things are going to change afterwards.
And if they're on pharmaceuticals, which is the majority of the population, it's a rare 92-year-old that doesn't take.
Well, sometimes you're
he
stuck
did
and
take
yeah, I
medication.
work, I won't take them off their thyroid medicines.
You'll keep them on their
Yeah, you can't do that.
anti-hypertensive, anti-diabetic
No,
medicine.
you have to. They've got to survive the treatment. So, yeah.
And how do you convince your patients to stay with no other medicines for a month?
I didn't hear that.
If you prescribe them, if you give them their therapeutic dose of 200 C, whatever medicine it is, and you tell them to come back in a month, our society sort of gets used to take medicine on the regular basis. How do you handle that? And do you see resistance?
It's all about education. You know, yes, we've been indoctrinated, every one of us, to take Tylenol every 4 hours, and we've been indoctrinated to take an antibiotic every 8 hours, or blah, 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 blah. And you have, you know, as I said, you're shifting paradigms here. You're dealing with something that's completely different and unique from what you're used to. And that takes a lot of education. It doesn't happen right away.
And the last one, do you tell your patients what medicine you give them?
If they ask, I do, yeah. Yeah, it used to be that homeopaths never revealed the medicines, and you can't get away with that anymore. So yes, I tell.
Do you give them placebo ever?
Do I ever give placebo? Yes. Placebo is a very helpful thing to give if you don't want to repeat the medicine, and you're just saying, wait, you know, I'm giving you psychological reassurance while the medicine works. So yeah, and a lot of people use placebo, yeah. Yes. And that's much different from the homeopathic medicine. Placebo is not the same thing.
Thank you, Dr. Whitmont. Unfortunately, we have to wrap up your session, but it seems like everyone here would love you to go on forever. But thank you very much for being here with us.
Thank you.
We definitely appreciate it.